All right, now I'd like us to switch our focus to the COVID-19 situation in the country. The Ministry of Health is admitting that the country is headed in the right direction in the fight against the COVID-19 pandemic. Ministry officials attribute this to the positivity rate that has been on a downward trend during the month of January, despite resumption of schools. Raquel Mugai with more details.
The latest remarks by the Ministry of Health regarding the fight against COVID-19 indicate that there is some hope after almost a year of a difficult and new normal for Kenyans.
Since the beginning of the year, from 1st of January, the highest positivity rate has been 6.8%, which was on 7th of January, and the lowest was 2.1%.
180 people are recorded to have been infected with COVID-19 within the last 24 hours, out of a sample size of 4,580, a 3.9% positivity rate.
Strictly speaking, you could say that we have actually flattened the curve, but flattening the curve is an event, so it's not very, very important, because for sure we'll still have these surges and spikes going forward until everybody is vaccinated and everybody is offered protection.
So far, of the three main known variants, only the South African one has been reported in the country. The latest one being from a truck driver who entered the country from the Lunga Lunga border point. 1,432 persons continue to receive home-based care, with another 469 being hospitalized, among them 26 people who are admitted in the intensive care units in the country. The ministry warning that the low numbers should not be a reason for Kenyans to lower their guard until such a time when critical vaccination has been done. With the world commemorating the World Cancer Day, the Ministry of Health was quick to emphasize the need for frequent screening, as every year Kenya records 42,000 and 27,000 cases and deaths respectively. 59 people out of the 1,773 persons who succumbed to COVID-19 were cancer patients.
One of the main challenges facing us in the fight against cancer is the low uptake of screening and early detection services for the most common cancers.
And as the country continues to record low COVID-19 infections, the nurses' unions in Kiambu, Kakamega and Embu have called off their strikes, a change of events that has the Kenya National Union of Nurses leadership questioning the procedure used by the respective unions in doing so.
Every worker has the right to go on strike. It does not say every worker has a right to go on strike through a union.
It reaches a time when we look at things and think the interest of the public overrides the interest of an individual. And that's why I've made this bold decision that we come back and serve the public.
Taita Taveta County has fired 300 of its healthcare workers who refused to resume work after being on strike for weeks now.
Tumechukua hatua ya kuhakikisha kwamba vile tumetangaza nafasi zingine za watu ambao watahitaji kuja kujumuika nasi kutekeleza huduma.
Despite industrial action by healthcare workers running on for weeks and a number of Kenyans failing to secure much-needed healthcare services, the Council of Governors maintains that individual counties be engaged if at all grievances are to be resolved. Raquel Mugai, Citizen TV.